Now, I cannot imagine the difficulty families are facing as this pandemic continues. We believe so strongly that children need to be in school, that they are essential to the mental and physical health of a child and to their academic success. We have been cautious throughout this pandemic, and we've pivoted when required to ensure we protect our schools, our communities, and our collective progress as we work together to get kids back to school and our lives back on track.
Our new approach focuses on empowering parents and students. This includes providing take-home PCR self-collection kits for students and staff who become symptomatic while at school, but also the rapid antigen tests are provided to students and staff as our supply is increasing, and enhanced screening measures are in place. With respect to testing, the use of take-home PCR self-collection kits in schools will only be used for students and education staff who become symptomatic while at school.
Ontario's Chief Medical Officer of Health releasing some new details today about what the province is doing to ensure schools are safe when staff and students return to classrooms next week. Minister Stephen Lecce says Ontario is doling out millions of HEPA air filters and N95 masks and ramping up rapid testing. This while cases and hospitalizations in Ontario are rising every day. But the province won't be tracking cases in schools moving forward. So as a parent, how do you decide whether or not to send your kids back? To discuss the science, we bring in our panel of medical experts tonight, Dr. Callie Barrett, a critical care physician at UHN and a member of the Ontario COVID-19 Science Advisory Table, Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital, and Dr. Anna Banerjee, Pediatric Infectious Diseases Specialist. Thanks to all of you. Dr. Barrett, I'll start with you. Does the science, in your opinion, support a return to classrooms next week?
You know, I think the first thing we need to say is that this is a very complex and nuanced issue, and there is no purely right or wrong here. But let's focus on what the science does tell us. The science tells us that there is a real physical, mental harm to children from being at home using remote learning. We also know that there is widespread community transmission of COVID-19, the Omicron variant right now, and that many people in the community right now are symptomatic or positive for COVID-19. We also know that when children go back to school, there will be cases that come into the schools reflecting that degree of community transmission. We know that COVID, for the most part, is very mild in children, but not in all children, and children with risk factors for becoming severely ill include children with chronic medical comorbidities, children who have underlying lung disease. And so it's a really challenging sort of risk assessment that each parent has to make. But we do know what works to prevent transmission in schools. Vaccination works to both prevent severe disease in adults as well as in children. Ventilation, filtration, masking, cohorting, physical distancing, all of these measures we know work and we know will help to reduce onward transmission.
I wonder, Dr. Barrett, if you have an idea in mind of a number of cases, because you said that is sort of an inevitable reality when kids go back to school. Is there a number of cases we could see, or a % of cases we could see in schools that would be acceptable and comfortable?
I can't give you that answer, no. Our goal should be to have the lowest number of cases in schools. And the number one way we should be achieving that is not by closing schools, but by having community-based public health measures to reduce the community transmission so that when children come to school, they're less likely to be infected and then potentially transmit within the classroom.
Okay.
Yeah.
Oh, you can go ahead.
No, it's okay. Go ahead.
Dr. Grill, I want to get to you. It sort of feels like parents here are in this position where they're forced to make a choice at this point between their kids' physical health and their kids' mental health. What would you say to people who are in that position?
Yeah, it's an excellent question, and I get that question a lot, not only from parents and kids in my practice, but colleagues are talking about this all the time, and I agree with my colleague when she says, it's important to go over the risks and benefits of the situation. And I would say it is complex. I do remind parents that there are major benefits for kids to be in school. So, we're seeing a lot of mental health issues in our practices these days. Most of it comes out of social isolation, not being with friends. There's a lot of anxiety. There's a lot of depression going on. And part of that is because kids just aren't in school. They're not in their sort of normal routine. The other thing is there's a lot of kids with learning challenges, and they don't get the same attention with virtual learning as they do in the classroom. And obviously, there are families that have been hit harder during the pandemic, low income, marginalized, even families with kids with disabilities that really can benefit from being in school, especially considering in those cases, sometimes the parents who are essential workers can't get to work, and therefore there's an income issue. So it becomes really tough. So I go over some of the benefits of the kids being in school. I also remind them, as my colleague mentioned, that for the most part, we've been fortunate that the cases of COVID-19 in kids are mild, and that if they're sick, they really do need to stay home. And the final thing I go over with them is I just mentioned the fact that, this is a complicated situation, and we're never going to get to, I think, 0 cases. To me, this is all about risk reduction and weighing the benefits versus the risks. And I would say that based on the Science Table report that came out today, I did have a chance to review it. I think it's very clear that the benefits of kids being in school right now, with the public health measures that are being put in place to reassure parents that we're making the environment as safe as possible, do outweigh the negative impacts of COVID-19 right now. And I am excited that the kids are going to go back to school on Monday.
Okay, let's talk more about this risk assessment. So, Dr. Banerjee, what are you seeing? What do we know right now about pediatric COVID-19 cases, and how should that help inform parents about this choice, whether or not to send their kids back next week?
So in Ontario, about 82% of children ages 12 to 17 are vaccinated, but only 50% of kids between the ages of 5 and 11 are vaccinated. And so that we have a whole bunch of unvaccinated young kids going back to school. If we look at what's going on in the States, there's a huge increase in certain parts of the states of children being admitted to the hospital. Again, COVID is pretty rare in children. Severe COVID is rare. So it's usually a mild illness, a runny nose, sore throat, maybe a fever, or minimal symptoms or no symptoms. But there is a small subset of children that will get really sick. So if parents are worried and they're anxious, I think the best thing to do, the best way to empower them is to do something active, which is really vaccinate your children. It's the kids that are getting admitted to the hospital in the States, they're almost all unvaccinated children. So again, we all understand it's a complex situation. There's a lot of pros and cons to kids going back, but if they're going to go back, then do your best to try to get the kids vaccinated, because that way you greatly reduce the risk of them being hospitalized.
So let's talk more about vaccinations. When asked about mandating vaccinations for children, Dr. Moore today said this is a new vaccine that we need to wait before mandating vaccinations for that age group. Dr. Barrett, what are your thoughts on that comment?
So I actually would like to know what Dr. Banerjee thinks about that, because as an infectious diseases physician, I think she's actually best suited to answer that. That's not within my scope.
Sure. Dr. Banerjee?
So, in some ways, I think if you're going to have kids go back to school, it makes sense to vaccinate them, to have all the kids vaccinated. The only problem is right now, COVID is out there everywhere. And so a lot of kids going to school are going to get exposed to COVID within the classroom and without and outside of the classroom. So, one of the things I could say is for now, the kids going into the classroom should all be vaccinated. And if you wait a while, then COVID will decline and then the other kids can come back. That's not going to happen, but that's a way it could have happened. I think mandatory vaccination, that's probably something I would have considered before, but now it's too late because on Monday kids are going back to school, but you want to keep kids safe. But still, we have a long way to go. 50% of kids 5 to 11 are not vaccinated, and they really should be to protect these kids.
But do you think if the province mandated vaccines today, we would see a huge uptick before next Monday?
I think we would. I would. But we'd also see some kids that probably will never get vaccinated, and they wouldn't be able to go back to school, which may not be a problem short term. But I think COVID's going to be here for a few weeks, a month or so, and then it's going to die down again. Who knows what's going to happen after that. But at this point in time, I would have liked to see vaccinated kids at school.
So you bring up a good point here about the peak of the Omicron variant. Are we there yet? Are we almost there yet? And when we think about that timeline, does it make sense to go back to school? Dr. Barrett?
I don't think anyone knows right now where we are at. There's some signal that we're hearing from our colleagues in jurisdictions in the province that the wastewater signal may be plateauing, but it's really challenging right now because we just don't have the same sort of incident case numbers that we did given the limitations on testing. But certainly some of my public health colleagues, what they're watching very closely to try to get a sense of this is the rate of new admissions to hospital and ICU. Again, it's a lagging indicator, the wastewater signals. And I think we're going to start to see an element of this in terms of student and staff absences in schools, and we're certainly closely watching that in the hospitals as well. And then my modeling colleagues are working really hard to try to figure out if there's other ways that we can get a sense of what's happening in terms of transmission using other data sources. So I think it's very, very difficult to say that right now.
So Dr. Grill earlier had mentioned that he was satisfied with some of the measures put in place today announced by the province. We're talking about those HEPA air filters and 95 masks. Dr. Barrett, what should parents be looking for in their kids' classrooms to sort of do this risk assessment at home before sending their kids back to school?
Yeah. So I think, as Dr. Banerjee mentioned, the number one thing parents could be doing right now is getting their children vaccinated and making sure that everyone who's eligible in their household is vaccinated. That is the number one thing you can do to reduce your likelihood of having severe disease and ending up needing to be in hospital. Then I would reach out to my school, the school principal or teacher, and ask what measures are in place in my children's classroom. Are they able to open windows? Is there a HEPA filter? What kinds of masks are the teachers wearing? What is their plan for cohorting and physical distancing and hand hygiene, and how are they going to handle staff and student absences, and what impact might that play on my child's education?
Dr. Banerjee, I want to ask you about this new reporting website the province was talking about today that will give parents access to absentee data before that 30% threshold. How much should parents be invested in these absentee numbers when we know that they don't necessarily mean these people have COVID?
Yeah, so I'm not really sure how useful that would be. One of the things that concerns me is that they said if a child has symptoms, that if they get 2 tests within 24 hours, they can go back to school. Mm-hmm. Right now, almost everything that's circulating is COVID. And we know that the tests, the rapid tests, are have a false negative rate of about 50%. So you have a kid that has symptoms of a viral illness, you should have that kid outside of school. You shouldn't have them, have 2 tests and go back in. It would make more sense. And the other thing is they're not reporting anymore, and parents won't know if there's a child in their classroom with COVID, and that if they should be monitoring their children or testing their children. I think the rapid test would be much more useful. That kid that has any symptoms should be out of the classroom, and if they knew that there was COVID there, then those kids should be screened as a test to stay kind of strategy. I think that's more effective than a absentee website, because really right now they're saying that they're not going to monitor what's going on in schools.
Yeah, that's a good point. Dr. Grill, I want to know what you're hearing from your patients about really how remote learning has impacted them so far.
Yeah, for sure. So, I think it really depends on the family. There are some, I'm a parent myself. One of my kids really likes remote learning, a little bit more casual schedule. My daughter doesn't really like it at all. She'd rather be at school with her friends. So I think it's very mixed in terms of what I've heard from colleagues. And again, I think it also depends on what your socioeconomic status is. Most of patients where parents really have to work, they're really struggling to not only find childcare, and they might have to miss work, but also not every family has the same access to remote learning, right? Not every family has enough computers for everybody. Wi-Fi setup can be different. So, I think it really depends on the situation. The bottom line is we do want our kids in school. I've spoken to my pediatric colleagues. We have one here on this chat. Most of them are in support of what the science table said in terms of in-school learning has all of these benefits. Vaccination access is not hard. I can tell you, I work in York Region. We have walk-ins for kids every single day at all the York Region clinics. They can just show up, not even make an appointment, and get their vaccination. And as it was said before, the schools are putting in numerous things to reduce risk. N95 masks for teachers. It's a very high level mask. You know, they're making sure that kids are screened before they get to school. So as Dr. Banerjee said, if they have symptoms, they should not be at school. They're starting to use rapid tests a bit more strategically so that, you know, if it's a positive rapid test, you're absolutely supposed to self-isolate. And if you do have symptoms, they're saying that 2 negative tests might be able to get you back to school a little bit quicker than 5 days. Similar in a way that we're using it with hospital staff. We're trying to pick up asymptomatic cases. And for those that are symptomatic, can they get back to work earlier? So look, these strategies, we're going to try them out. We're going to see how they go. It's a very complex issue and challenging time. But at the end of the day, we're trying our best, I think, to get kids back in school in a safe environment. And if the province has to pivot, I have no doubt that they'll make changes.
Dr. Grill, you said that you support this decision to reopen schools next week. Do you think this will last?
I really hope so. I mean, I'm trying to be as optimistic as possible. And I think Katie said it very appropriately at the beginning. This is complex. It's not black or white. You know, I really do feel for the teachers and the students, and especially the parents. I mean, these are challenging and scary times. But we're doing our best to look at the science, use the best modeling data that we have. I think, you know, we did take a bit of a break to try to increase the vaccination rates, to try to get the things in schools like HEPA filters and masks, try to give the schools a bit more time to prepare. You know, there were some teacher absences and we were trying to make sure people were able to get back. So I do hope it lasts. We know that the peak of this wave, we're hoping starts to come down, you know, in the next few weeks. But look, you know, if things change, I think schools will pivot. And I really hope we don't have to close schools again, because at the end of the day, I really think that hurts the kids, and it has all these other effects on parents, especially in marginalized populations that have sort of been hit the most during this pandemic.
Dr. Barrett, I want to end with something you said right off the top, which is that there's almost no right answer in this situation. But until we're done with Omicron, this decision about whether or not to send your kids back to school really might be reassessed every day, every week for some parents. So certainly a very fluid situation. Looking ahead, how will we know if these public health measures announced today are actually working?
So I think we're just going to have to follow these surrogate measures, and it's going to be a challenge, but it's going to be are the rates of hospitalization decreasing? Are there fewer children off with symptoms compatible with COVID? Are there fewer? I mean, even anecdotally, are you hearing about fewer of your friends whose children or either they themselves have COVID-19? And once we have better data, and hopefully as the children go back to school and there's this testing strategy, hopefully we'll start to have some better data and there will be trajectories that we can follow. And so that's what I'm pretty optimistic about, that hopefully we will start to get some better quality data. The testing will be a little bit more, there'll be more capacity for it. And we will be able to sort of make changes. But my final statement would be, if it's not going well, I hope that the public health measures that are used to control transmission are not the schools, and that it's out in the community, and that it's our outside of school contacts, and we are going to protect education as the essential place for children to work.
Okay, thanks to all of you for your time and your perspective on this. We'll have to leave it there for now. Dr. Callie Barrett, Dr. Alan Grill, and Dr. Anna Banerjee, thanks to all of you.
My pleasure.
Good night.